We're here this afternoon with Dr. Scott Freedman, who's Dean of Therapeutic Discovery at Mount Sinai Medical Center. And your group has been sharing with us some of the exciting things you're doing here. I wonder if you can just talk a little bit about the vision you have for the center here at Mount Sinai.
Well, Mount Sinai is a very unusual institution. We're committed to pushing the boundaries of innovation in every domain that we are responsible for. Better care of patients, better discovery of drugs, better commercialization so they can get out to our patients. All of that together creates an ecosystem that's actually one of the most unique on the planet, we believe. And in particular, we need to train the next workforce, so we have unique educational programs, we have clinics of the future, we have, I would say, enormous strength in big data, genomics. So we're really trying to push the boundaries of what academic medical centers should provide to advance the health of our patients.
It's really exciting. Are things like this happening at other university medical centers?
I think to some extent major academic centers are embracing new technologies, and each one in its own way. You know, there's an old saying that if you've seen one academic medical center, you've seen one academic medical center. I think, you know, great medical centers like ours recognize the need to develop disruptive technologies, explore managing health data and research in very new ways, and engaging the next generation to create new tools for us. I couldn't tell you with detail about what other institutions are doing, but I know that in one form or another, other institutions have programs around innovation and technology discovery.
So what is one significant change you would expect patients to see in the next 2 or 3 years in terms of medicine?
Right, well already, you know, we're using apps for patients to do a lot of self-monitoring. That has streamlined data collection, improved communication between doctors and patients, and most importantly, improved care. We learned about, from one of our experts, an app that patients are using to monitor their diabetes. And so we can have a 24/7 sense of whether their diabetes control is adequate. There's dozens and dozens of apps now for everything from sleep quality and length to appetite, diet, exercise, of course. There's, you know, hundreds of different programs out there. We're trying to both develop our own and find what the best fits are for our patients to use these technologies meaningfully.
It's exciting times. Yeah. Thanks for sharing with us this
my
afternoon.
Pleasure. It's been great. Great to have you.
So we're here this afternoon with Dr. Bruce Darrell, who is head of clinical information at Mount Sinai Medical Center. And he has shared with us some of his knowledge around what's happening in clinical information, use of technology and working with patients. Tell us a little bit what you see the major developments and the impact it's going to have on patients over the next few years.
Well, I think it's clear that patients are expecting more in terms of what technology can do for their overall health. They are appropriately asking physicians, clinicians, and their healthcare organizations to make healthcare as easy, as simple, and as fun for them as all of their other digital experiences. And so I think you're going to see more of that over the course of the next several years.
And as physicians, what does that mean to the physicians who are treating the patients?
What it means for the physicians, most of all, is more opportunity, more digital simplicity, more options for their patients, more ways to take care of them, whether it be new ways to communicate with them, to educate them, more wellness tools, apps monitoring for them. It means that they are going to have to adopt these new practices because their patients are going to expect it more.
Yeah. And what will patients in the next 2 or 3 years, what's perhaps the most significant change in terms of healthcare and how they experience the healthcare system that they should expect to see?
While I think a lot of the excitement and interest is around the flashy things like how to use Fitbits, trackers, mobile wellness apps, and I think there's a lot of healthy excitement about those. I think a lot of what patients are going to be looking for is very fundamental. How can I text my doctor? How can I get an answer at 10 at night? How can I make it easier to use technology to do the simple things like pay my bills, schedule my appointments, figure out, do my medication refill? You know, there's a lot of opportunity in just the basics.
Lots of opportunity, exciting times. We're here with Dr. Darrell, one of the real experts in using technology in healthcare. Thank you.
Thank you so much.
Thanks for.
Well, we are here with Dr. Singh at Mount Sinai Innovation Center, who you've just given us a wonderful presentation about some very innovative projects that your team is working on, the Global Initiative project. Can you tell our viewers a little bit more about a day in the life of the Global Initiative?
Great, thanks so much. I lead an institute called the Arnhold Institute for Global Health. And usually when people think about global health, they immediately think to a certain type of work that's been done over the last 30 years. Impressive work to reach the hardest to reach people and give them things that they need and start to build services and capabilities. We have really tried to build upon that and take a twist. The type of people that we brought into our team, which then will help you kind of understand a bit of what we were able to do and what we're doing, are people that, for example, come out of industries like user interaction design and service design. The same sort of people that might help build the flow of a service in a consumer industry, we think have a lot to do to organize the disorganized world of being somebody who's low resource in a tough setting that's trying to just navigate basic needs. So you bring in the disciplines of user design and service design, and then put them together with people that have backgrounds in data science, machine learning. And what you can do is begin to learn how people are interacting with your services and keep on rebuilding them and redesigning them, as long as you've done so in ways that are lightweight and cost effective. You need a third piece on that team, which is clinical insights. At the end of the day, this is about actually doing things that have health impact. And so you need a group that's there, that's not running the show. It's not the doc and the scientist who's just telling the expert view of how things are, but they're actually giving a bit of guidance and context to people as they're trying to solve challenges that are in the health domain. And so what you get is a really flat team that's working very carefully together, or fluidly together rather, and they're able to do things that, for instance, are like build the first ever set of population health management platforms in rural Guatemala. You'd never expect technology that shows satellite maps, mobile phone inputs, clinical records, weather data, infrastructure, electricity, water, and delivering it in a very user-oriented way to the people that are doing the work. We like to think about what we're doing with Atlas as something like a Waze for frontline health workers, bringing insights to them and learning from them to build a broader view of what is going on in health in these very low resource and tough settings. So the Institute essentially is just really focused on how do we find breakthrough services, technologies, and methods that can scale for the most underserved and hard to reach populations in the world. And what I love about being at Mount Sinai is that we really recognize that they are also in our backyard, and that what we learn in other settings is very much applicable to our challenges here in the US. And that's part of why we have a team that fluidly moves between domestic work right here at Mount Sinai and learning from the best of what we see abroad.
Wow, thank you so much.
Appreciate it. Thanks so much.